Hello, this is Simon Hyatt. I'm the contributing editor of Hong Kong Business Magazine. Today I'm presenting the Hong Kong Business Technology Excellence Awards, celebrating the best, the most innovative, and the most dynamic digital projects from across Hong Kong's business scene in 2021. Today I'm joined by Dr. Kenneth Sung, the Chief Executive Officer of Gleneagles Hospital in Hong Kong. Gleneagles has won the Online Services in Healthcare Award. Kenneth, thank you so much for joining us today, and congratulations on your award win.
Thank you, Simon. On behalf of the Gleneagles Hospital Hong Kong, I would like to thank Hong Kong Business Magazine for granting us this award for our remote hypertension care program. We are very honored to have won this, and it is a great encouragement to our staff and doctors who have been involved in establishing the program. And as a member of a global healthcare group, the IHH Healthcare, Gleneagles strives to be at the forefront of healthcare innovation by leveraging medical expertise and advancements in technology. So this award scheme is a great occasion for us to share with the wider business community our commitment in delivering high quality and innovative healthcare solutions to meet the changing environment and patients' needs, especially in these times of COVID. And thank you again for recognizing our effort in this initiative. And we wish Hong Kong Business Magazine continued success in advocating and celebrating business excellence in this city. Thank you.
Can you tell us a little bit more about Gleneagles Hospital in Hong Kong and a little bit more about the innovative remote hypertension care program? How, in fact, does it work?
Thank you, Simon, to give us this chance to explain a little bit more about this program and about our hospital. Let's talk about Gleneagles Hong Kong first. We actually call it the GHK, which is an acronym for the hospital itself. So GHK is actually a state-of-the-art multi-specialty private hospital, and we were opened in 2017. It is a joint venture hospital between the IHH Healthcare, one of the world's largest healthcare providers, and the NWS Holdings Limited of Hong Kong. And we also have an exclusive clinical partner, the University of Hong Kong, providing a lot of support in order to let us provide high quality, innovative, transparent, and accessible care to people in Hong Kong. So with the help of Hong Kong U, we are actually a teaching hospital, a site for training professional medical doctors and other healthcare professionals. Specifically about this program, I would like to tell you more about it. We actually have started some sort of telemedicine program around 1 to 2 years ago. That was actually before the pandemic comes. We were working with a local telecom company in order to start thinking about how we can do teleconsultation and also medication delivery service. This is proprietary telemedicine platform Dr. Go, which has been launched almost like 2 years now. At that time, we were only doing general practice kind of like cases, people with sore throat, headaches, or sometimes aches and pains, or some skin lesions. But then we moved forward. In April 2021, this teleconsultation service was extended to chronic disease management. And this is this particular hypertension program that we are now talking about. It is the first of its kind in Hong Kong, and it provides a wide spectrum of hypertension care support, uniquely combining face-to-face and video consultations, which is provided by doctors and dietitians from Gleneagles. There is also medical and dietary advice on top of the remote blood pressure monitoring. There is also in support the door-to-door delivery of prescribed medicine as well. So in this particular way, we are actually providing patients with an option for not coming into the hospital, as well as an enhancement of what they can do in terms of monitoring their own blood pressure.
Kenneth, can you explain a little bit more about how the program helps hypertension patients, especially amidst the pandemic?
Thank you, Simon. This is such a good question. A lot of people have asked us, what's the highlight about this program? What's the difference of it in comparison to a typical just kind of like face-to-face consultation? So the pandemic has caused patients a lot of difficulty in reaching and accessing medical care. In particular, elderly patients or weak patients or patients who may be what we call immunocompromised, let's say they have cancers, and therefore they really do not want to visit high-risk areas like a hospital. So with this sort of program, we were able to provide patients with an option for not coming into the hospital and yet having their hypertension come under control and cared for by medical doctors and dietitians. And specifically under this program, the blood pressure readings can be recorded regularly in the comfort of their home, and the use of a connected blood pressure meter with a 4G SIM card, and these data will be uploaded to a cloud platform. And these data will then be auto-charted for health readings, which will be reviewed by doctors and also nurses in our hospital. So therefore, the patients have the options of not coming in, as well as having auto-charting of their results. And this particular charting is an enhancement of care, which honestly, previously, even with physical care, cannot provide. Because in the past, usually doctors see these patients maybe, let's say, 4 weeks to 6 weeks, in some of the cases, even almost up to 3 months. But with this sort of monitoring, doctors will be able to monitor the result of these patients, whether the drugs are providing good treatment to these patients, and therefore be able to review if there needs to be any sort of extra follow-ups or change in drug medications. And then on top, patients will be very aware of their own health conditions as well. And therefore, because of this self-awareness, they will be playing more role in the management of their own health.
Kenneth, what other healthcare services does the hospital offer?
The GHK, as I was mentioning just now, is a full-fledged tertiary hospital. We actually offer a comprehensive range of healthcare services that any tertiary hospital would offer. There are 35 specialties and subspecialties that are being offered right now in GHK. Specifically, which is very interestingly, we are the only 24-hour emergency medicine department in the whole of the Hong Kong island. We have 15 specialist outpatient clinics, and we have inpatient services with over 240 all-inclusive fixed-price medical packages on surgeries and procedures in various specialties. This is very important, and we are always highlighting this all-inclusive fixed-price medical packages is because of the fact that this provides peace of mind for clients when they do use our hospital services. Take, for example, if they come for a joint replacement, we provide them with an advisory on how much they need to pay. For the 6 day, 5 nights they stay in the hospital, we actually would not go over that fee advised price. It is a cap. So even if there are complications during the stay of the patients, we actually cover it. Therefore, patients will be very comfortable in using our service, knowing that they will not pay 1 cent more than what they have been told. And in addition to the general inpatient service, we also have several centers of excellence. For example, we have a joint replacement center, we have a spine center, and also a kidney stone center. Recently, we have also set up the maternal fetal medicine center, which is one of its kind in Hong Kong. And then in particular, in Hong Kong, there aren't that many real critical care services for inpatient. We at GHK have the adult ICU, pediatric ICU, as well as the neonatal ICU. Furthermore, other than the hospital itself, we also have a satellite clinic in Central, which provides outpatient care for people in the Central District, and therefore more convenient for them.
They're wonderful services, Kenneth. If I can extrapolate a little bit more, what sets Gleneagles Hospital apart from other healthcare providers? We
have actually recently been talking to many people, and they have been asking us very similar question. Why has there not been a healthcare group from an international healthcare group which has established hospitals in Hong Kong? In fact, yes, we are the first healthcare group establishment in Hong Kong, with the IHH Healthcare being our mothership. We are able to leverage the group's strong international work network and resources to bring in new and advanced technologies, equipment, and also best practices. And also, an additional thing that we always mention is the hospital's collaboration with the University of Hong Kong. It has allowed us to put in place strong clinical governance, which ensure quality care, patient safety, and clinical efficiency. With their support, we have in place a robust, comprehensive credentialing process to ensure medical practitioners practicing at the Gleneagles have attained the necessary qualifications, experience, and also professional standing. The hospital also provides a teaching ground for students in medicine, nursing, and pharmacy. So don't be surprised if when you're in the hospital, you actually see students, whole groups of students walking around learning from their teachers. This is very important because this is the thing that contributes to the long-term development of healthcare professionals in Hong Kong. And we do believe that the Gleneagles Hong Kong have a responsibility in that.
What is next for Gleneagles Hospital?
We have two major strategies that I would like to highlight to any people out there who are interested in what's next for us. We have what we call a development strategy. We are still in a growth mode. The hospital is not fully open yet. Despite that, we are already 4 years old. We are focusing on developing and expanding our services. In the medium run, it's our plan to look for building a network of healthcare services around the city, so not just in the hospital. The second strategy that I'm moving towards is innovation. And digitization of hospital services is the way forward. We want to enhance patient experience and engagement. For example, we will further develop our own patient app. It's called the My Gleneagles Smart Health, with more functions such as online payments, teleconsultations via the app, so you won't need to sit in front of a computer. We also want to offer interactive online inquiry service to facilitate more personalized services. Other than these two strategies, we also want to introduce more advanced and innovative treatments as well, which I think with the partnership with Hong Kong U is something that we must distinguish ourselves. So to continue to introduce more advanced techniques such as treatment solutions for our patients is also very important. Recently, we have adopted a robotic system for different sort of surgeries, for example, in joint replacement, and we're moving towards general surgery as well. And obviously, since we have been awarded this business award in telemedicine, telemedicine is definitely one area that we are moving towards. And we're partnering with other sectors and leveraging their technology to extend similar services for the management of other chronic diseases.
Thank you, Kenneth. Finally, what does it mean for your team to have won in the Hong Kong Business Technology Excellence Awards in 2021?
This is obviously a great encouragement that the team's effort in helping enhance patient self-awareness of their health conditions via more integrated use of health expertise and technology is recognized. We are all very elated about it. The launch of the remote hypertension care service is a very good starting point for us to explore further how remote monitoring with teleconsultations may be adopted to the management of other chronic diseases and therefore benefit for more patients. And we were very, very encouraged by this. And we thank the Business Technology Excellence Award for giving us this chance.
Kenneth Tsang, Chief Executive Officer of Gleneagles Hospital Hong Kong. Thank you so much for joining us today. And congratulations once again on your award win.
Thanks so much, Simon.